it is my pleasure and privilege to introduce Dr. Jeffrey White. He's the Director of the Office of Cancer and Complementary and Alternative Medicine at the National Cancer Institute. So he's right down the street, and we're very pleased to welcome him this morning and to talk about this area. Thank you.
Well, thank you. Thank you, and I'd like to thank the organizers for inviting me. I appreciate the opportunity to come and speak with you. I've never had that pleasure before to meet with this organization. And as I'll point out, one of our activities of my office is to try to do some outreach to learn about information needs from groups like yours. So, so just an overview of what I'm going to be talking about. Basically, have some general comments about complementary and alternative medicine, some things about the status of CAM, I'll use the acronym CAM, research that's NCI funded, and then a little bit about information resources for complementary and alternative medicine, and something about clinical trials, and aspects of exploring practice of CAM with regard to cancer, and then some comments about low-risk interventions, and then a summary. And I'll try to do all that in a relatively short time so that at least we have some time for questions. I'm particularly interested in what your questions are. So many of you may know that complementary and alternative medicine has a kind of fairly weak definition. It's a negative definition of what it's not. It's medical healthcare practices that are not part of integral part of conventional Western medicine is the most commonly used definition in the United States, and the World Health Organization has a similar one, but it puts it in the context of the country that is being that's under consideration, so that it's not part of a country's own tradition and are not integrated into the dominant healthcare system in that country. So we basically break down complementary and alternative medicine into a series of categories to be more specific about what we're talking about. And so the first one is alternative medical systems, such as traditional Chinese medicine or Western systems of medicine, like homeopathy is a whole system of medicine, and energy therapies, which are predominantly, people think about the so-called, what I call theoretical energies, so things that come from often Eastern medicine or Eastern philosophies, such as Qigong, which I see you have represented here at your meeting, and Reiki. And then exercise, if you know the NCCAM classifications of these domains, you'll see that ours are a little bit different. Exercise we break out as a specific area. And then manipulative and body-based therapies, mind-body interventions like hypnosis and imagery, nutritional therapeutics, so diet modifications or other dietary supplement usage, and pharmacological and biologically based therapies, which I think a big category there is botanicals, and spirituality and spiritual healing. Again, we break that out from the mind-body group, which is which other groups may have it lumped in there, and then a miscellaneous category. And then the term complementary is generally thought of as approaches that are used in combination with conventional medicine and alternative approaches used instead of conventional medicine. And just some things about the term, the integrated term or the combined term of complementary and alternative medicine. It's a very complex, I'd say poorly defined hodgepodge of ideas and practices with varying levels of acceptance by different segments of the society. So in a lot of ways, it's very difficult to talk about it as a field because it's so many different things that many of them don't have any real association with each other. Now, there's tension between the two terms of complementary and alternative, and some people are very resistant to the term of alternative and viewing it as uniformly negative. And actually in much of Europe, the term CAM is really not used. It's more complementary medicine. Alternative medicine is rarely used as a descriptor of the area. And I think in part this field, there's some there's some clashes between, what I call culture clashes, between practitioners and researchers. And so that's not just really unique to CAM, but it's amplified, I think, because of the topic. And often, because CAM is dominated in practice by practitioners often who are not researchers, and, but now researchers are coming into the field, and there's some issues in communication between these two groups. Just again, to keep on a little bit on the topic that CAM is not uniformly viewed as a positive phenomenon by, throughout the society. There are groups that have expressed concerns about even CAM research. And for example, here's two. I just gave two examples: Quackwatch and a website called Science-Based Medicine. And these are some of the concerns that they express on their websites or in their literature. One is about the low plausibility or pseudoscience. Again, a lot of this is really predominantly focused on the alternative medicine side of it, but anyway, these are what they have their concerns about. Poor quality of the research, concerns that complementary and alternative medicine research may distract from more promising topics that are in the conventional realm, have concerns that it legitimizes unscientific and ineffective therapies, and also have concern that negative findings from research may not eliminate the use of ineffective therapies. These are the concerns about research. There are concerns about CAM practice. Some of them are that it's not evidence-based, that it's exaggerated potential for benefit, and it sometimes delays patients from receiving conventional therapy. So this is just, but there's what I call a bright side. The bright side is that, to me, is that there's more interest among researchers and practitioners in the field as a whole. And I'll show you some things about that. There's more NIH-funded research in this topic than that's grown up over the past several years. And more research results are being published in high-quality journals, in medical journals. And there's more dialogue between healthcare practitioners and patients about these topics. However, this bright side is really mostly about complementary medicine and not so much about alternative approaches. So this is just a picture of part of the NIH campus out in Bethesda. I'm focusing on the clinical center. The National Cancer Institute, where I'm from, is, is throughout the campus and off the campus. My office is actually off campus. But just to give you some kind of a picture of the NIH, NIH is, I guess, nearly now 30 different institutes and centers that make up the NIH as a whole. And our office in the National Cancer Institute is about 12 and a half years old, and I'm the director. And these are our program areas, which I'll tell you some about each of them. And our mission is to improve the quality of care of cancer patients as well as those at risk for cancer and those recovering from cancer treatment by contributing to the advancement of evidence-based CAM practice. I'm sorry, I'm favoring one side. I know that many of you looking over here. The sciences that support it and the availability of high-quality information for healthcare community researchers and the general public. So I mentioned that I would say something about our interest in trying to gather information, and we are trying to do an assessment of cancer patients' needs for CAM information, and these are the goals that we have. And basically what we've tried to do is to, we started with going to healthcare practitioners that are information resources in the cancer centers that NCI supports and elsewhere, to ask them, well, what are the questions that you most commonly get from patients or caregivers about complementary and alternative medicine. We're trying to gather some of this together to help us fill in some of the gaps in the information. So anyway, that's something that I want your organization to know about and express interest to work with you to meet your needs in this topic. One of the things that we do is every year as we report what the NCI is doing in this field, and we do it with an annual report that's published online. But now it's exclusively online. We used to make hard copies of it, but you can get to it from our website, my office's website, which is cancer.gov/CAM. And this is for the 2009 because it takes us, although we're in fiscal year 2011, it takes us a while to compile this information. And it gives you a breakdown of a variety of different things, highlighting some of the specific research topics. Again, it's across the board in cancer, not focused on any disease type. But within it, you will learn about some of the disease type breakdown. But just with regard to how much money the National Cancer Institute puts towards research in complementary and alternative approaches, or some aspect related to that, annually it's in the $115 to $120 million range over the past several years. So I just wanted to direct you to some websites, and start with our website, which is, as I mentioned, cancer.gov/CAM. So it's, although it's our website there, and you can find information out about our office from the About Us, it's really about and it's about more than just our office. So you can get links to health information from a lot of different resources. Many of them are government resources, or some of them are fact sheets that come from cancer centers that are on different topics, and I'll show you some related to complementary and alternative medicine. You can find out about clinical trials and programs that we're doing, and a variety of different things. So I encourage you to take a look at it and see what you might find of interest there. One of the things that it'll link you to is the Medline Plus, which is, I know, have any of you utilized Medline Plus? If you could just show me your hand if you can. A couple of people, all right. So, I don't know if I did that. Sorry. So Medline Plus, Medline is the National Library of Medicine's database of medical literature, and Medline Plus is a doorway to that that's more user-friendly for the general public. And within it, you can go to these different topics, and you can find in here research that relates to complementary and alternative medicine. And one of the things that I found on it was a list of herbs and supplements that you can click on, and you can get fact sheets and information about a variety of quite an extensive list of herbs and supplements through Medline Plus. A little bit about CAM clinical trials and symptom management. I should say that in preparing this talk, I try to, and I'll come a little bit to some things that are more specific to mesothelioma, but it is a topic for which, with regard to complementary and alternative medicine, there's not very much literature that's directly related to it. So we have to pull literature from other areas of cancer that might be relevant. So this is some research that was funded by the National Cancer Institute, and it's done at the MD Anderson Cancer Center in Houston, and it's about an approach of Tibetan yoga, and it's used for fatigue and sleep in cancer patients. Lorenzo Cohen is the director of the integrative medicine program there, and this is some research that they performed on lymphoma patients, 39 lymphoma patients that were randomized to receive either Tibetan yoga or waitlist control, which basically means that they were not given any kind of intervention, but asked for a period of time to not make any change in their general, not to do the yoga, but after the study was over, then they would be able to start a yoga intervention. And it looked at various parameters of sleep and found that that the patients that were on the Tibetan yoga intervention had consistently, looking at these different parameters, improved sleep quality, sleep duration, latency, time to going to sleep, and so on. I chose breathlessness as sort of a symptom or that is associated with many patients with mesothelioma, and to try to look at what kind of literature might be out there that relates to complementary and alternative medicine. And I found that there is a systematic review of the literature that's done by the Cochrane collaboration, which does a lot of this kind of work. And basically, this is just a list of a variety of things, but I just wanted to point it out because I wanted to look at for acupuncture, because I was aware that there was some research being used at acupuncture for breathlessness. And and actually it did find that there were 5 studies of acupuncture used for the treatment of breathlessness, but it found that they considered it to be a low strength of evidence to support its use. But there were, but that was in part because of size of the studies and just overall, I think it's predominantly the size. And then also this is beyond just cancer. So when you look at cancer breathlessness, there was only, I think, one study here that was one acupuncture study for cancer breathlessness. But a variety of different things have been looked at. What they found here was these different approaches of chest wall vibration and neuroelectrical muscle stimulation, about which I don't know very much, that had high strength of evidence. But just again to show you that there's research that goes on that's relating to complementary and alternative medicine for symptoms that are significant to mesothelioma, and some of this information is available in synthesized form from these groups like Cochrane. So I should skip and go ahead to neuropathy. So neuropathy or chemotherapy-induced neuropathy, I think many of you know that cisplatin and some other drugs that cause damage to the nerves are things that plague many cancer patients. And there's been a variety of approaches that have been looked at to try to prevent this neuropathy. Specifically for cisplatin-induced neuropathy, one of the things that has been studied has been vitamin E. And I think the point of this slide is that is to talk somewhat about, how do you analyze data that are data sets, I guess, that have different kinds of outcomes. You have studies that are beneficial and studies that show benefit of the intervention, studies that don't show benefit. And it's interesting that that these 2 studies that both showed some this is actually prevention. So these are patients that are starting the vitamin E at the same time that they start the cisplatin, and to try to prevent advanced forms of neuropathy. And this study from Italy and this study from Greece both showed protection against this against neuropathy, not absolute protection, but decreased numbers of patients getting high levels of toxicity. And the one study from the North Central Cancer Treatment Group, which was here in the United States, centered at Mayo Clinic, actually did not show any beneficial effect. I think there's complexities in how you evaluate these kinds of things. One of the things I look at is the form of vitamin E that's used, but actually in all 3 of these studies, alpha tocopherol is used, which is the most common form of vitamin E that's in dietary supplements, although there are a lot of other components to vitamin E. But at least there's some commonality there, although perhaps one of them is a little bit different with this DL formulation of it. But anyway, this was really a very negative study. It's not like it was that it was close to being positive. This was really definitely negative. One of the things it might be is that the kinds of chemotherapy that were looked at in this latter study was chemotherapy with cisplatin with taxanes and other drugs that cause neuropathy, whereas in these 2 studies, they were cisplatin-based chemotherapy, but the other drugs were not neurotoxic. So there's some. So I'd say that although there is some data to suggest that vitamin E, and particularly in the alpha tocopherol formulation, at doses around 400 milligrams daily, may have some effect or in preventing cisplatin-induced neuropathy. There's still some debate about it, but neither one of them showed any adverse effects associated with it. And I use that as an example of something to talk now about clinical trials. How do you find out about clinical trials? And I chose neuropathy treatment as a topic to try to, where if you had an interest in looking, where would you find a clinical trial on that? You can go to the NCI's clinical trials database, which you can actually access through our website. So that cancer.gov/CAM, you can go to the clinical trials tab there. And here I found 3 studies. 2 of them were about acupuncture. So I was really just focusing on complementary and alternative medicine trials that were associated, that were for neuropathy treatment. So they're out there. You can find this information. And since those 2 were about acupuncture, I wanted to again focus on what NCI is producing with regard to information. And this is the PDQ, is Physician's Data Query. So this is the NCI's literature review program that we do. We have a board, an editorial board that generates summaries of the literature on different complementary and alternative medicine approaches, and this one's on acupuncture. Acupuncture related to nausea and vomiting, hot flashes, pain. It's all summarized in this one summary, and you can find that on the website as well. So, okay, so this is the portal from our website that shows you if you click on that clinical trials, you get to this page, and you can pick either a certain kind of cancer, and actually mesothelioma is there, or was when this slide was made anyway, and or a different symptom. And at the time, this was back in May that I did this search, there were 330 clinical trials that were related to complementary and alternative medicine that were in the database at the time. And you can cone down on your own area. I did a search then for the Baltimore area, just as an example, again, on complementary and alternative medicine and supportive care. I limited it to that and got these 3 trials that were in Baltimore. So this, just to give you a little familiarity with the database. And now a few things about the, this is just what NCI is supporting in clinical trials of CAM approaches for symptom management this year. And it's just, instead of giving you a whole lot of details, I just give you a condition and an intervention. And so all of this is active clinical trials of curcumin for radiation-induced dermatitis and acupressure for fatigue and so on, and acupuncture for xerostomia, and a variety of different things for chemotherapy-induced nausea and vomiting, acupressure and acupuncture, vasomotor symptoms, postoperative bowel paralysis, and several things on pain, postoperative pain, including some interventions which I was surprised to see. Soy protein as a modality for the management of postoperative pain. And we actually had the person that was doing this research come and give a talk at the NCI about 2-3 years ago. Sleep disorders that we mentioned earlier, sexual dysfunction, and a variety of things. So there are NCI-sponsored trials of all these different interventions. So I'm going to tell you about one of our programs. It's called I'm going to focus here on the NCI Best Case Series program, but that program is managed by one of the programs in my office, the Case Review and Intramural Science program. But this is just to let you know that the National Cancer Institute has certainly been aware of the use of alternative approaches for many years and has been asked to review or to explore the potential value of different approaches over many years. And dating back to NCI was started in 1937, and so from the very beginning we started looking at a variety of different approaches, or the Institute did. I wasn't here at that time. And these are just some of the things that were looked at different time periods. And in the 1990s, what developed was an approach called the NCI Best Case Series program. And it is an approach that allows anyone to provide case report information to the NCI about patients with cancer treated with unconventional cancer therapies with alternative approaches. And we're the only program that's broadly advertised in the world that expresses a willingness to review documentation excuse me, of cases of patients treated with these unconventional approaches. And what we need is actually, I mean, we need real material. We need actual records, medical records on these patients. And after that review, we actually need to review the pathology, slides to confirm diagnosis, radiographic films to confirm response. And what we do this for is to determine if sufficient case report evidence is available to justify NCI-initiated prospective research for specific CAM practices as cancer therapies. What we don't do it is there's no intent to make a definitive assessment about or statement about the efficacy of a therapy. It's not an approach to determine whether or not vitamin C or something like that is an effective cancer therapy, but we use it as a sort of an early screen to try to identify things that warrant NCI-initiated research. And in the time that I've been doing it, there have been 3 things that have come through that we think warrant some investigation, warrant some further investigation, and they're listed here. A homeopathic approach actually from India, insulin potentiation therapy, which is the use of low doses of chemotherapy along with intravenous insulin as an approach to try to augment the activity of the chemotherapy, and a macrobiotic lifestyle, which is diet, but is also mind-body approaches. So just to wrap up, I'm going to just mention that, and I've mentioned some of these things before, and this is just a group of, or some low-risk interventions to consider for different situations. But I really want to make a push for dialogue. I think this is the most important thing when I talk to groups like this about complementary and alternative approaches, is though I do think that, certainly patients and family members are interested in what information that they can garner on a topic. I think when it comes down to decisions about the use of an approach, it's very important to do it in collaboration with your healthcare practitioner. So, but these are some things that for which there is some evidence, and that it gives a basis for some discussion. Some of them are not probably particularly relevant to this situation, but nausea and vomiting with acupuncture and or acupressure, as I mentioned, prevention of cisplatin-induced neuropathy with vitamin E, as I mentioned before. This one about prevention of cisplatin-induced renal toxicity is really, it's interesting to me. That there's a substantial body of literature about the use of, actually it's intravenous glutathione for the prevention of cisplatin-induced kidney damage. But it is almost exclusively from Europe, and as far as I know, there's been very little uptake in the United States with regard to that. Actually, very little uptake, I'd say, also in Europe with regard to just the general practice of it, which is an interesting phenomenon to me, because in my review of this, I cannot find a study that showed that there was some decrease on the effectiveness of cisplatin with the use of intravenous glutathione. But unfortunately, it hasn't made it into, made much dent on practice. Neuropathy treatment, I mentioned acupuncture. I think I didn't show you, but there's at least one small study suggesting there might be some effect, and there's ongoing research, as I pointed out already. Insomnia with yoga, poor appetite and weight loss, omega-3 fatty acids, and fatigue. We mentioned the yoga study, but also aerobic exercise. So in summary, and I'd like to then open this up and get your questions, is that cancer and CAM and cancer is a complex field of practice and research, and NCI supports a large portfolio of research in this area. It's good quality information. There is good quality information available on this topic. I think you can find a lot of those things from our website. There are certainly other resources that we don't link to, perhaps because of some protocol reason that we don't. We are somewhat restrictive in linking to only certain kinds of sites, and I'm happy to talk about other things. Research is exploring the potential value of CAM approaches for patients with various cancers, and here are some approaches that I've already mentioned with potential benefit. And I think that's where I left it, and I'm I'm happy to answer your questions. I'm very curious to see what it is that you have particular interest in. Excuse me? Oh.
I have a question about the omega-3 fatty acids.
Yes.
Do you recommend that for patients who are currently in treatment or patients who've completed treatment? Was there any interference, in other words, with radiation or chemotherapy?
I'm not aware of any data to suggest that there's any interference with it. And it has been used in patients that are undergoing treatment. But generally, studies don't get really well designed to look at the interference effects of these kinds of approaches on outcomes. But there certainly are studies. I'm pretty confident, although I have to go back and look specifically at what kinds of situations in which it's used in combination. One of the things that I think is interesting and that warrants some investigation is that there's some preclinical data to support that certain kinds of chemotherapies might have some improved activity with certain lipid compositions of the diet. That hasn't been really looked at very much in clinical trials. So I can't say that it would be something that would augment the effectiveness, but I have not seen anything that suggests that it would interfere with chemotherapy. I think they want us to go to the, want you to go to the...
I just wanted in terms of the organizers, are there slide presentation for this later?
I don't think so because I didn't send it in advance.
Can you go to the line, please?
She's asking if there's slides available, but I'm sure we can make them up.
Alice, all the slides will be available on the website as well. Okay.
Hi. I think I missed what you said about fatty acid, the reason it's listed.
Yeah, so there have been a lot of studies about omega-3 fatty acids for weight loss and anorexia, and there have been both positive and negative studies. And so I think it falls into this category of similar research to what I was talking about vitamin E. You can certainly find studies that will go either way on that. But with regard to the issue of is there any evidence that it would interfere with cancer therapy so that you would have a concern to use it in combination, I'm not aware of any research like that.
Have you heard? Okay. Have you heard of a substance called inositol?
Inositol.
Inositol?
Inositol, yes. And there's inositol and inositol hexaphosphate. Inositol hexaphosphate, which is has been looked at. I don't know about inositol itself as a as a CAM approach, but I can't tell you chemically very much about it, other than the fact that but I can tell you that it has been looked at in some animal studies of cancer, and it was promoted actually by a doctor at the University of Maryland who had done research with it, with injecting into animal tumors to show some cytotoxic effects on tumors. But I don't know of any, there's no clinical trials. Well, I did hear that there was a clinical trial some years ago, but I have not seen any results of it. So all I can say is that yes, I know that there are dietary supplements of out there of this, but so far as its use in cancer patients, I can't find any results of any clinical trials.
You mentioned that acupuncture is used as a treatment for cisplatin-induced neuropathy. Is acupuncture used to relieve the pain or to reverse the progress of neuropathy?
In those studies, so I think I'm only really aware of one clinical trial that's reported, but I showed you a couple that were ongoing. I think that what they're looking at is actually to improve the pain scores, so that it's more than just to prevent progression. It's actually to induce some improvement. The thing about acupuncture research is a very complex research to do because of controls, because certainly there's a substantial placebo effect or most likely there is with acupuncture. And so you need to have proper controls. And some of these approaches, you also need to be sure, it would be nice to have non-treatment control arms in the studies as well, because some of these things like neuropathy have their own spontaneous remission rate. So you need to know, you need to be sure that you have a good comparator for that.
I have two questions. I'm an NCI patient, and I'm curious, when you go to the website, as you're encouraging us to do, to look at the clinical trials available, are most of your clinical trial patients or participants self-referred, or if they see something that they think may benefit them and they're already undergoing treatment either at NIH, NCI, or another facility across the country, do they approach the investigator of the clinical trial through CAM, or do they go to their oncologist and say, I think I may be qualified for this, would you allow me to participate in a CAM clinical trial while I'm also undergoing the current standard of care for meso, for example? So how does that work? Because I have gone to your website looking at the clinical trials a few months ago when I was told your options are limited, you can no longer have surgery, you no longer qualify for NCI clinical trials. I thought, well, if CAM exists at the facility where I'm being treated, NIH and NCI, why not try an alternative approach? And I'd like to change my diet. I'd like to incorporate exercise or acupuncture or yoga. I'd like to do these things. I'll do anything, of course, to stay alive. How do I get involved in a CAM clinical trial while also continuing with the standard of care, such as local chemo back home? Mm-hmm. That's my perspective, is that I'm open-minded. I want to participate in all these things that may benefit me, but you have to fit the criteria for a CAM clinical trial, and then also convince your, for example, NCI oncologist or your oncologist wherever you are, that this may be a benefit to you. As a patient, you're motivated, you want to survive, you'll do anything to survive. You've seen and heard about other patients that have survived using change of diet or change of lifestyle, complementary treatments, alternative treatments, homeopathic treatments, but you have to fit that narrow criteria of the CAM clinical trial, find one that pertains to you, and it may not be at NIH or NCI, it could be, for example, at MD Anderson or at UAB in Birmingham, Alabama, or in California. But going online, I find places like the Gersten Institute in San Diego, where they have the change of diet and lifestyle, mostly the vegan or vegetarian lifestyle, and they say, I'm cured of cancer, I no longer have my tumor because I quit eating meat or animal products. And so I want to know, is CAM using that whole body approach with the change of diet and lifestyle, and not just these targeted therapies of yoga or acupuncture? And so how do I find these studies, and how do I participate?
So, yeah, I think, so the first part of your question about how do you get into a trial, and do you need to make the contact yourself, or do you need to have your oncologist to do that? I think generally most of the trials are looking for a physician-to-physician contact, or somewhat medical office to medical office contact. In part because it's most efficient to get all the information that's necessary to determine if somebody is eligible for the study, and then also to see if there might be any contraindication for why someone might not be eligible for the study. So I think if you have an interest in the trial, although you can, I'm sure you can do some data gathering on your own by contacting sometimes a point of contact for a clinical trial. Ultimately, if you decide that you have an interest in determining if you're going to go on a trial, it's best to have your physician's office to make the contact. I think some of the rest of your question about finding sort of trials that have more that give you access to different approaches, like some of the things that you're talking about, diet changes and things like that. Certainly, you'll find that there's although there's 330 trials in that database that I showed you. There may not be the kind of trials that you're interested in, and there may be healthcare practitioners that make claims about the use of diet modification or whatever, or that even indicate that they have clinical trials. I think it's important that you be aware of sort of some of the regulations around clinical trials, and that the terminology of clinical trial you get a little bit familiar with, and you maybe sometimes kind of push a little bit or query healthcare practitioners about what they might call a clinical trial. How is this really registered? I mean, is this an IRB approved clinical trial? Is there any kind of regulatory oversight of this study? Because I've certainly heard a lot of people talk about that they have clinical trials or in their office, but they use this term, I think, in a very loose kind of way. So, but all these trials that are on this database are registered with this database, which requires certain kinds of documentation, and not always, though, an IND. So that doesn't necessarily mean that there's a FDA oversight of all those clinical trials. I think most of the ones in this database there are.
Good morning. I saw on your previous slide about other studies that had been done in the 80s and 90s. You had Laetrile listed there.
Right.
Do you have anything?
Well, Laetrile, yes. So it is from a research point of view, it's sort of a topic that died out around that time. I can't find any other clinical trials, and we have a PDQ summary on Laetrile. But I think the last clinical trials on Laetrile that you'll find in the medical literature, I think, are from the late 80s or possibly very early 90s. And although, yes, there were some in the trials that were NCI supported, there was no activity demonstrated with Laetrile or amygdalin, and there was some toxicity associated with it. It's certainly still utilized you'll find in many of these centers and these clinics in Mexico or other places that utilize Laetrile. And again, if you ask them, I think you have to ask them what is the evidence that it's based on, and it's not based on any clinical trials data that I'm aware of. So I'm very happy to talk with anyone that has questions afterwards. I'll be around for a few more minutes, but again, thank you very much for this opportunity.